Hi everybody, it's Cookie Lou in Arizona. It's Monday, January 30th. This is 7 days since I had my duodenal switch surgery. So I thought I'd come in with a quick update. I do have an appointment in about an hour. I have to leave in about maybe 10 minutes. I have to go down to my anticoagulant clinic to have my INR checked, my blood thinning levels. They want to know where they are. Really quickly, first week was pretty good. Tummy was really sore. Took my medication, my liquid Vicodin, pretty much as prescribed. The first 3 days at home, and then I just took it twice a day. And now I'm just taking it at night before I go to bed because they don't want me to. They want me to be a little sedated while I'm in sleeping. They don't want me to kind of roll over on my stomach or anything like that. Bruising is going away. It was quite black and blue, and I'm thinking, I keep comparing this surgery with the one before, with the VSG that I had done 5 years ago. And I think the reason why I'm much more bruised now is because they did a lot more pulling and tugging of the intestines, and I think they were probably in there longer. And I'm on blood thinners now, and that probably attributed to a lot of the bruising that I have. So, but it is going away, and they tell me to expect a lot of blood to be pooling under the skin, and if I see, big bruises here and there, it's perfectly normal, it'll clear up, which it is. I feel a lot better today than I did day of surgery. Belly is getting better, it's not as sore. Bending over, of course, hurts, or twisting, is uncomfortable, so I try not to do that too much. Basically, a little bit of the statistics of my weight loss is I was, after my VSG, I never really got out of the obese stage. And that's one of the main reasons why I decided to try the DS, to see if I could lose all this additional weight that I've been carrying. It didn't work as well for me as it should have. I probably didn't work the tool as well as I should have because of the fact that constant stalls and constant lack of weight loss just depressed me and kind of fall off track when that happens. But I worked at VSG. I did what I was supposed to do 98% of the time. And I just didn't lose enough weight. I lost a total of 60 pounds. 20 of that was pre-op diet. So, the VSG only gave me about maybe 41, 42 pound weight loss in 5 years, and it just wasn't acceptable. So I decided to do the DS, and I was almost guaranteed by my doctor that I will lose a lot of weight with this one. This is the mothership of all surgeries. There's nowhere else to go from here, so it has to work. I'm going to do a body shot so that you can see where I'm at. Like I said, I'm still real heavy, very hippie, have a lot of weight on my bottom half of my body, and it needs to come off. So that's why the DS was done. When I started my journey with the VSG, I was about 301 highest weight. Probably most of that, well, not most of it, but about 7 pounds of that was water. I had edema in my legs when I had that particular weight. But most of the time I was carrying about 297 pounds. I lost 60 pounds of it within the last year between extreme back pain and damaged wrists and the narcotics I was on. I regained 30 pounds. My highest weight after VSG was 270. After pre-op diet for 2 weeks, I went down to 260.1. When I was in the hospital, I was always curious. A lot of people say, when they give you all the intravenous fluids, you usually gain a couple of pounds. And I was doing my little rotation around the nursing ward with my walker, and I saw a scale there, so I hopped on it to see how much weight I might have gained with the fluids in it. It registered 266 pounds 1 ounce. So I gained like 6 pounds with fluids. Today is my 1 week surgery after DS, and I'm 257.7. So I'm still losing a little bit of weight. It's an acceptable amount. My incisions have surgical adhesive on them, and they were quite itchy. I was going crazy. And like they said, don't touch that adhesive, don't peel it off, let it loosen up and peel off on its own, which it's doing. I try keeping it clean with cotton swabs, and it's healing up. They're healing up. I have 7 incisions. I have 5 in the midriff, and I have 2 in the lower belly, which surprised me. I didn't realize they would go down there. But I know they have to pull on the intestines, and they have to make I think another connection down there. But I have 7 incisions altogether. Bruising is getting better, like I said. And I have to see the doctor for my 2-week follow-up on the 7th of February. I'm going to ask him if I can start eating some soft foods, like soft vegetables or something, because I'm really tired of liquids. This is starting my 2 weeks pre-op, 1 week post-op. They want me to do another 2 weeks of full liquids, protein shakes and soup and stuff like that. And I don't feel as if I'm getting enough nourishment. With all this malabsorption that I'm going to be facing now, I really don't know. I mean, my calories are like, if I have 600 a day, it's a lot. It's really not enough, especially if I'm not absorbing all that. So I've been taking some vitamins, not many, because I have some on order that I'm going to go to the post office today and pick up, because I had my mail held for a week, so I'm going to go pick it up, and the vitamins should be in. But all I'm taking right now is I take a B12, I take a biotin for hair and nails, I take the Prilosec the doctor gave me, take a vitamin D. I'm not taking any calcium yet, and because I have some liquid calcium that's coming, and I'm going to start that rather than the pills. So that's pretty much it. I'm going to step to the back of the room and give you a body shot. You'll see when I stand up the reason why I did the DS. I just still a very heavy woman, and after 5 years of struggling with a VSG, I don't think I should be, but I am. That's why the DS was done. Current weight today is 257.7. Before I started this was 270, so I'm a little smaller, not much, but just for my own record and for you to see where I am today, 1 week after DS surgery, and then how my body changes along the journey, so we can have a little bit of some photographs so we can see the difference. Okay, back to the room I go. Still bottom heavy, very hippie, a lot of booty. My stomach is still very swollen from the surgery, but there's still plenty of stomach there. I still have the hips, and I have the arms. And that's it. Got to get rid of it. Okay, I gotta leave. Gotta go see how they're gonna change my warfarin medication. I know they're probably going to. Well, anyway, just a quick update. Very nice talking to you today. I don't know if I'm going to do a video every week, but certainly at least once or twice a month to kind of give everyone an update on how I'm doing. Thank you so much for all the people who supported me and sent so much positive thoughts and prayers for me. I was nervous about the surgery. Thank you, Rosemary, Gastric Rose. You know, I could always count on Rosemary. She called me about a day or two after my surgery to say, "Hi, Cookie." You don't look like you just had surgery, you know. And we chatted for a while, and we caught up with each other's lives. And she wished me well, which, you know, she's such a sweet, loving woman. I love my Rosemary. And anyway, so just wanted to stop in real quick and let you know what's going on so far. First week, I'm healing, I'm on the mend, and I'm feeling good. Okay, everyone, have a wonderful week. Cookie Lou sending lots of hugs and kisses. Bye.